The COVID-19 vaccine has been here for several weeks now. Many in our community are choosing to get the vaccine and want it as soon as possible, and some have already received it. The information is changing quickly related to the vaccine, who can get it, and where they can get it. And many of you have asked us some questions. Today, we've invited our Public Health Director, Philip Mason Joyner, to answer some of your questions. Hi, Philip.
Hi, Kimberly.
Things are changing with the vaccine really fast. Can you tell us now who is eligible to receive the vaccine?
Right now in the Portland metro area, including Clackamas County, we're still really busy working hard to vaccinate all of the folks that are eligible in phase 1A of the process that's set up by the state. So phase 1A, it includes our frontline healthcare workers. And when I say frontline healthcare worker, that's a really broad and large group here in our region in Clackamas County for our community members. It also includes all of our first responders of all types, and there's over 900 of those in the county. And then it also, phase 1 also includes some of our most vulnerable residents. So staff and residents at long-term care facilities, adults with intellectual or developmental disabilities, along with their caretakers, folks who have medical conditions or disabilities where they are required to have home care services, and we have mobile teams going out to provide those vaccines. And so when it's all said and done, phase 1A is over 27,000 people eligible in Clackamas County. Starting this week, the last week in January, educators are now eligible to receive the vaccine. So this group includes all of our public and private schools, all of the daycare providers across the county, and that's a whole lot of folks that we're working to get to access to appointments to be vaccinated. That work's starting now and over the next several weeks, and because of limited supplies, it potentially is going to take a few months. In upcoming, the next group will be older adults. Starting February 7th, older adults will be eligible to receive the vaccine, and it will start with folks who are 80 years or older first.
That sounds like thousands of people within Clackamas County are now eligible to receive the vaccine. So how will those folks get the vaccine?
Well, it's important to remember lots of the folks right now in phase 1A are healthcare providers or associated with healthcare organizations, and they've been able to get the vaccine through their employer. We've also helped to enroll all of our long-term care facilities in the federal pharmacy program, where mobile teams go out and take care of their staff and residents. So that work is pretty much completed or near completion at this point. And then we have community clinics where we help fill the gap. That's some of the work we're doing locally. When we have vaccines available, we're reaching out to eligible folks, getting them scheduled for vaccinations.
Okay, so for the rest of us, such as the public, most likely we're going to get our vaccine through our primary healthcare providers when it's our turn.
Yeah, that's the intent, is that once we have enough doses available in the community, that it'll be easier to access through your clinics in your cities, through pharmacies. At the county, we're also having drive-through events.
So we want to clarify that right now when we're talking about community clinics, these clinics are meant for people with who've been prioritized in specific groups. For example, recently we had an event for people with intellectual and developmental disabilities, as well as their caretakers. People who are working in the education field, you'll most likely hear from your school or other administrators on how to get the vaccine for you. So we want to be clear that right now, the clinics that we're doing, they're not open to the public. They're only ready for the people who are currently eligible and within a specific grouping. All right, Philip. So how long will some of us in phase 1A, educators and older adults, have to wait to get the vaccine?
It's going to be a while. I think it's really important to share directly with the community that we just don't have enough vaccine coming in right now to take care of all the folks who are eligible and want access to a scheduled appointment. By the end of February, we're going to have over 1.2 million Oregonians that are eligible to receive the vaccine. And based on the information we're receiving from the state around the allocations that are coming into Oregon, we aren't even going to get half of that, enough doses to be able to meet that need. Things are continuing to change rapidly, however, but at this point, we're expecting this process to take months and months. It's going to be even longer before the vaccine's readily available across communities for all the populations that we want to have access.
Well, thank you, Philip, for joining us. And thank you for joining us. But there's a few things to keep in mind before we close. If you are eligible to receive the vaccine right now, you can visit our website. And from there, we will link you to the state's system to sign up for an appointment. However, there's a few things to keep in mind with the system that the state manages. One, if their appointments are full, you will not be able to schedule an appointment for yourself and you'll have to try back later. Secondly, the servers can only handle so much, and so only about 1,000 people a time can access that tool. If you are not eligible at this time, or even if you are eligible and looking for the vaccine, again, there's very limited access to get it. And unfortunately, the public health department or the county can't set up an appointment for you. So the best place to keep up to date is by visiting our website. And from there, you can get more information on who's eligible, and you can connect directly to the state website to get the more details. So thank you for joining us, and please stay safe.